just so you know, in case there's media that I haven't spoken to, my name's Todd Ricker. I'm the lead labor rep for the Maine State Nurses Association. Thank you so much for being here. This is incredibly important. Nurses have not been kept safe in the emergency room at Maine Med. Management made some concessions yesterday that they're talking about as if it was their plan all along or it's what they've been doing all along. That is nonsense. The concessions they made yesterday are brand new. We're waiting for them to still be put into place. You're going to hear from nurses, and you will see in your press packs the abuse, the brutality that they're experiencing through workplace violence. No matter what the stats are, no matter how hard it is to place people who are violent, no matter what the difficulties our management has at this hospital, it is their job to keep people safe. That's it. We don't disagree that it's hard to find placements for some of these folks. We want them to get the best care possible. The issue is safety of nurses when they go to work. So here's what's going to happen. We have 4 speakers. City Councilor Tori Pelletier is with us. She's going to say a few words after the 3rd nurse. Then there's going to be a delegation that goes into the hospital to briefly talk to Jeff Sanders, if they can find him, and then they're going to come back out. And they're going to report to us. Of the 3 speakers, you are more than welcome to talk to any of them one-on-one, get an interview. My phone number, if you need any follow-up, is in your press packs on the press release, okay? Any questions before we get started? All right, great. Thank you again for being here. Go ahead, Lucy Dawson.
Hi, my name is Lucy Dawson, Lucy-Dawson. I'm a nurse in the ER at Maine Medical Center, and I am also a member of our union's bargaining team. I have been emergency room nurse for 20 years. We are here today to be very, very clear. Maine Medical Center is not keeping us safe. When we are not safe, our patients are not safe. Over the past several months, multiple emergency room nurses have been brutally attacked by patients. We have repeatedly asked our department management to make simple, common sense improvements to prevent workplace violence and keep their staff and their patients safe. They have continually refused our requests. Violent attacks on nurses are increasing, not decreasing. Instead of recognizing its failure to keep us safe, Maine Med has continued to do what is not working. Worst of all, Maine Med is not listening to its nurses. We told our management that we needed better staffing to prevent workplace violence, and they gave us a violence committee. Committees just produce words, not immediate action. It will not keep us out of the danger we are in right now. As you know, we are currently bargaining our first union contract. During the first part of our bargaining session last week, we addressed the issue of violent attacks on nurses. 2 of our many nurses who have recently been attacked and injured by violent patients spoke directly to the hospital's representatives. They showed management pictures of their bruised faces and the lacerations on their bodies, and they still refused our simple improvements. We also presented a petition signed by over 90 emergency room nurses, giving them our simple, common sense recommendations for safer working conditions. Two days later, the emergency room management told nurses that the hospital would not take any of these recommendations and that things will be fine. But things are not fine. Things are very far from fine. We are not fine. One of our nurses was nearly killed recently by a violent patient who tried to choke him to death. And he is not alone. We have been hit, bitten, choked, shoved, kicked, spit upon, and concussed. We have had broken bones and continue to face verbal abuse. These violent and verbal assaults are contributing to our moral distress, our anxiety, our PTSD, and are increasing our staff turnover. I want everyone to know that as of yesterday afternoon, Maine management finally sat down with us to listen. Because of this, we have now won a commitment for better staffing and increased security presence. It took a long time and too many nurses being injured, but this is movement in the right direction. We call on management to immediately staff the ED based on the brand new commitments they've made for us. There is still more for Maine Med to do. They need to meet all of the common sense recommendations we made to them in our petition, and they need to listen to us when we call out for help, instead of rejecting the solutions we now offer for the dangers we face at work every day. Thank you.
Thank you all for being here today. My name is Heather Emmons. That's spelled Heather. Emmons, Emmons. I'm an emergency room nurse here at Maine Medical Center. I've been a nurse for a year, but I've worked with the department for over 3 years. While Maine Medical Center does its best to cover up its negligence with nice words and flowery aspirations, we are being attacked by violent patients in the emergency room. Let me be very clear. We are not here to blame our patients. They are sick and they are injured. They're in an unfamiliar place. They do not have control over their environment or even the conditions that brought them into our care. We are here for their emergencies and we are here to help them heal. But we are not here to suffer the physical and psychological trauma that workplace violence inflicts on us. As emergency room nurses, we know what we signed up for, but we also know that Maine Med can do a lot more to keep us safe and to prevent workplace violence. What nurses and caregivers need is for this hospital to provide the necessary resources to staff our department properly. That means more nurses. That means more and better security. That means giving a damn about the fact that nurses have nearly been murdered at work just for doing their job. And if there's anything our employer has, it's resources. Maine Med is constantly adding floors, rooms, departments, wings, and parking garages. All that's great, but if even one nurse is killed in our emergency room, is any of that worth it? Should a nurse's children or spouse be robbed of their loved one ever coming home again just because Maine Med won't properly staff our emergency room? We are not exaggerating when we tell you that many of us are scared to death that this will happen, and sooner rather than later. And what does this anxiety do to us? How do you think our moral distress affects our ability to work, to sleep, to have any respite from our jobs, even when we're not there? This hospital, like many other hospitals in our state and in our country, have refused until now to really hear what nurses are saying. We are telling them that their meager efforts to date are just not good enough. And that as much as we love our jobs, many of us are choosing to walk away rather than to risk injury or worse just because we're doing our jobs. The hospital industry in Maine and across the United States keeps spinning their message about a nursing shortage that it can do nothing about because there are just not enough nurses. But that's simply not true. There are lots and lots of nurses, just not very many who are willing to work in conditions like these, like the ones that exist in our emergency department. Like Lucy, I was thrilled yesterday to hear that Maine Med wants to do better. I'm hopeful that finally, after all of the scratches, bruises, cuts, black eyes, and other injuries, that we are going to have more of the staff we need to care for our patients. Maine Med must keep the commitment that it made to emergency room nurses yesterday. And it must make the same commitment to all of our nursing colleagues across the hospital. Safe staffing for all, so all patients can get the care they need. Thank you.
Hi everyone, my name is Meg Dion. It's spelled Megdionne. Good afternoon and thank you for coming. My name is Meg Dion. I'm a nurse here in the emergency room at Maine Medical Center. I've been a nurse for 7 years. The problem of workplace violence in the emergency department at Maine Med is getting worse, but it's not new. The issues we face at Maine Med are now at a crisis point, but they're not unique to the state of Maine nor the rest of the country. In fact, the threats to our physical selves and the lack of resources we need to prevent workplace violence are just a symptom of a much larger problem. That symptom being our employer trusting its own judgment over the experience and wisdom of frontline caregivers such as ourselves. Nurses are the experts on how workplace violence happens and what prevention measures will be effective. And that's why we formed our union in the first place. We saw that management of our hospital could do anything it wanted to us without any accountability. Maine Med could underpay us, treat us unfairly, discipline us without just cause or due process, and generally disregard our opinions if it wanted to. But that has now changed radically and for the better. Collectively, we nurses are now equal to our employer to determine our pay, our benefits, and our working conditions. We're making historic progress at the bargaining table on our first union contracts. And as powerful as it is to have Maine Med agree with us on our bargaining priorities, we have a long way to go to ensure our safety, particularly in the emergency room. As you know by now, we put our concerns in writing in a letter that was signed by 90 emergency department nurses here at Maine Med. We clearly laid out the problem and dangers we face, and also the solutions that require our hospital to spend the necessary resources to keep us safe. Last Friday, a few days after we made these demands, our management told us that they rejected all of our common sense recommendations and that they were already doing all that they could to keep us safe. But as of yesterday afternoon, something changed. Maine Med is now committing to do some of the things that we asked for, like improve staffing and bringing in more security guards. While these are just some of the things we need, we believe these commitments are a good start as long as Maine Med keeps its promises. But this raises a very important question. Why is it that this hospital is suddenly listening to what nurses have to say? Why is it that when staffing issues have been a constant complaint of Maine Med nurses for many years, that the top management of our hospital suddenly agrees to make improvements in our emergency room staffing? Before we organized our union, before we started having press conferences in public, before we had a united voice across our hospital, none of us would ever imagine we could win any concessions from management on patient care needs. But today things are different, and that's because we have a union. Maine Med has a long way to go to fix our emergency room and also fix staffing issues across the entire hospital. But now we know how to get the hospital to move in the right direction, and we'll keep fighting, both to make sure Maine Med keeps its word to us, but to finish the job and improve nurse-to-patient ratios in all departments across our hospital. Now, to remind Maine Med of these new commitments to nurse and patient safety, we are going to deliver a copy of our signed petition to our hospital's president, Jeff Sanders. We want him to know that we take him at his word, but we also want him to keep it and to make sure all emergency room nurses and patients are safe at Maine Medical Center. As soon as we have delivered our demands to Jeff Sanders, we will return here and report back to you.
Everybody. I'm Victoria Pelletier. I'm the District 2 City Councilor. Do you need me to spell my name?
You don't mind.
Victoria Pelletier. So I think it's important not only as a counselor of this district, but as a community leader, a Black woman, and someone that is very familiar with fighting to be seen and supported, that I stand here in solidarity with the Maine Med nurses today. Because I think, quite frankly, this is a very common issue that has existed for a very, very long time. And while this specific issue is in regards to management, once again, not listening to the demands of workers or not doing it in a timely fashion, because I have been made aware that some of the demands have been met. It also highlights a larger issue of power dynamics, of lack of respect, lack of value, and lack of support for individuals in the workplace. It's concerning to me how much upper management of organizations and institutions have normalized these dynamics that exist within decision making. The workflow of management making decisions from above for the workers who are in the trenches is and always has been a systemic class issue. In a city that prides itself on its food and its beverage and its healthcare, it's important that we shift the power to the workers, amplify their voices, and value their opinions. The expertise of the most affected needs to be prioritized, and we need to stop thinking that statements of solidarity, chicken parm, or post-shift applause is an adequate form of support and compensation. Again, none of this is new. The hierarchy of workplaces takes class, race, ethnicity, gender, ability into consideration and utilizes existing oppressive tactics to work against the employees that are faced with the most challenging, physically, emotionally, and mentally demanding job duties. The system is working exactly the way that it's supposed to. And until someone stands up and refuses to perform until workplace conditions improve, we will continue to be underpaid and undervalued. The nurses of Maine Med deserve a safe and supportive environment with access to decision-making tables on every issue that will directly impact their quality of life within the workplace. The workers are the backbone of this city and deserve a safe, well-compensated working environment as they continue to treat the most vulnerable of Portland. And if you won't do it for them, they will build their own table and they will do it themselves. You need them, we need them, and a lack of support for their demands, especially in a time when the pandemic continues to infect thousands, is negligent and unacceptable. So while I am very excited to hear that some of the demands have been met, I want to make sure that this is something that's consistent and we don't need to get to this point in order to be heard. Shift the power, dismantle the oppressive management structure, and stand in solidarity with those who work extremely hard to keep us safe and healthy. Thank you.